Disclaimer: topics discussed from timestamp 2038 to 3045 may not be suitable for all audiences. Enjoy the show.
That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey, everybody. Welcome back. I like to start with a surprise every time. So, this is the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandi is my other half. And
we've decided to start each podcast with a giggle.
That's it. You know, I found out, this is going to sound silly, it's totally off topic. I found that there's actually, in the old days, there was a recording, a vinyl record of someone laughing. And people would listen to it and they would laugh. And the way it happened was a guy was playing a clarinet or some kind of wind instrument. And he sounded so bad, his wife laughed at him. And he kept playing and she kept laughing. And the laugh got more and more and more. And it got to the point where he had to put it down and start laughing himself. And the whole thing's recorded and like they started selling it. And
that's so funny.
So people get to have laughing sessions by listening.
We used to have laughing sessions.
Recording, yeah.
When we first met, got engaged, got married, we would sit at the table with your parents.
Yeah.
And we would have a laughing session, which was like somebody would start laughing for no reason deliberately.
I think it would cure depression in a big way. I'm not talking about like if you tragically lost someone, you're depressed about that, or you know something bad's going on in your life. But if someone has depression, I think laughing sessions can be like a drug. And basically, I would just fake laugh, and then I'd go, okay, now your turn. You fake laugh, and someone else would fake laugh, and then someone would laugh at someone else's fake laugh, but it ended up being a real laugh. But because they laughed, and that person realized their fake laugh was funny, so they laughed.
It's
and
so
then
contagious.
Next thing you know, we're sitting around this dining room table, laughing hysterically, tears coming down our eyes.
We've had some good laughs.
Good ab workout too. I mean, when you laugh really hard, your stomach gets sore. It's nice.
Yeah, you're breathing heavy, so it's a good toxin release. You're crying, which is a toxin release.
Endorphins.
I mean, really, I think we should all laugh every day.
Every day.
Intentionally.
Every day. Laugh. Like if you don't feel like laughing, just laugh and you'll feel better.
I think it's medicine for the soul.
Yeah. It's like smiling makes you feel better too. I always say nothing's more beautiful than a smile. Nothing's more attractive than confidence.
It's true.
And but now confidence doesn't come from laughter, but it comes from other things. Confidence actually comes from keeping promises you make to yourself. Right?
Wow.
Because it's called self-confidence, right? So it's your confidence in yourself.
Yeah.
So if I make a promise to you and break it, that's different. If I make a promise to me and I break it, next time I make a promise to myself, my subconscious mind won't believe it. I won't have any confidence in that promise that was to myself. So do not break promises to yourself. In fact, put more value on the promises you make to yourself than to other people. I learned that from, I believe it's Ed Milet. He has a great podcast. He was talking about that, and that's
a great thing to keep in mind.
It makes perfect sense.
That might be a good thing for us to all keep in mind this year.
There you go. It's a new year.
We're looking for.
By the way, today is National Quit Day.
What?
Yeah, it's National Quitter Day or National. This is the day because we're recording this on January 10th, and this is the day everyone who made a New Year's resolution quits. This is when everybody quits.
Did you make a New Year's resolution?
Kind of.
I don't. We kind of started earlier.
I make mine on October 1st.
Yeah.
So I have 3 months because people slow down in November. As soon as November hits, they slow down. They stop working on their goals. They stop working on their plans. So I start my New Year's resolution is done on October 1st, and then that way I actually ramp up through November and December.
Yeah, so you have 30 days to create that habit and make it normal.
And one of my main ones is I want to read the ESV version of the Bible cover to cover.
Oh, that's a good one.
So I pick different versions every few years, and that's the version I'm reading through. And I got through the book of Leviticus, and I'm in the book of Numbers now. Very exciting stuff.
That's awesome. Good job.
Why don't we start?
Let's do it.
They don't want to hear about that.
We have some fun articles today.
Yeah, cool things.
Yeah. So how about let's talk about light.
You got it. This is from Everyday Health. It's called Light Therapy Shows Promise as Alzheimer's Treatment. New research suggests light therapy can improve health and reduce depression and agitated behavior related to dementia. You know, what I didn't mention is what I mention before every podcast, which is our goal here is to read these articles and summarize them, explain them, and talk about how they apply to your life. And our goal and hope for you is that you'll live longer, you'll feel better, get stronger, live longer, and feel younger.
Yeah.
And so light therapy seems to do that. And we're a fan of light therapy because we do light therapy in our offices.
We do. And are you okay before we dive too far in? I think there's probably a lot of people who haven't heard about photobiomodulation or light therapy, or if they
But
have.
everyone knows what the sun does.
Well, not everybody knows what the sun does, though.
Okay.
Right? Because we're just told by general
Yeah.
media
Yeah.
that we need to put this thick lotion on our body so that the sun doesn't kill us.
Right.
Right. And so, but there's so much that light does for our body. And so let me just read, if you're okay with this, let me just read something here so that we're on the same playing ground here.
Okay.
So photobiomodulation, which is light therapy, there are numerous examples of light-induced photochemical reactions in biological systems. Our vision is based upon light interacting with photosensitive cells in our retinas called photoreceptors. When light is absorbed through these cells, a photochemical reaction occurs, converting light energy into electrical signals that are transmitted to the visual processing centers of the brain. Vitamin D synthesis in our skin is another example of photochemical reaction. When the ultraviolet UVB wavelength in sunlight strikes our skin, it converts to a universally present form of cholesterol, 7-dehydrocholesterol, to vitamin D3. The negative effects of the absence of light on the human body are also well known. Two examples include seasonal affect disorder and the lack of vitamin D production leading to rickets. A lack of vitamin D in the body, vitamin D deficiencies, have also been linked to certain types of cancer and other
Heart disease also.
Yep, other disease processes.
Osteoporosis.
Mm-hmm. So basically we're using light, a light that's been, created through technology in order to replicate how the body reacts to sunlight. Now they talk about it only in the realm of Alzheimer's and light affecting regions of the brain. But there are other uses for photobiomodulation. Pain relief is one. Sports injuries, reducing inflammation. So these are things that we use it for. So we use it for reducing pain and inflammation, trigger point therapy, things of that. I think it can also, depending on where you use the light, can also create stem cells.
Absolutely.
Is that that's
if
right?
If you use it on the breastplate
Mm-hmm.
or on the shins where the bone is real close to the skin, it actually goes into the bone marrow and increases stem cell production.
So I just thought that would be nice for us to read so that everybody kind of has an idea about how that works. But I thought it was an interesting.
Vitamin D plays a role in your immune system as well.
Oh my gosh, so many things.
And if cholesterol is being converted to vitamin D, you don't have as much cholesterol in your blood.
Right. I think too, one thing that a lot of people don't know or realize is that depending on where you live in the world and depending on the season that you're in will depend on whether or not you walk outside, if you're getting any benefit from the sun whatsoever, right? Because like where we live in Maryland, once fall hits, you could be outside, for 2 hours in your tutu dancing, and you're still not going to get the amount of sun that you need to help produce the levels of vitamin D that we need normally. And so then we talk about the need for supplementing, which is a whole other conversation, which we don't necessarily need to get into today.
Yeah, because if you supplement, you're not converting cholesterol into vitamin D. You're just putting vitamin D into your body.
Right.
You have a tutu?
I'm not going to talk about it.
You dancing your tutu out in the sun?
I used to. I don't have my tutu anymore.
I live with her. I've never seen this.
Okay.
While light therapy has been used to treat depression, often in those with seasonal affective disorder, researchers are finding that it may also be a powerful approach to relieve symptoms related to Alzheimer's disease.
I think this is very exciting because there are little to no side effects of light therapy. And so to have something that an Alzheimer's patient can literally sit in front of for 30 minutes and see such cognitive improvements, I think is just amazing. And I to have this occur where somebody is actually saying, "Hey, here's a natural therapy that is not going to interfere with any other medication and is showing improvements we can't get anywhere else." So I think that's exciting stuff.
Yeah, I'd rather do that than drugs. It says light therapy not only alleviated depression, it also reduced sleep troubles and agitated behavior such as abnormal vocalization, restlessness, repetitive
And
movement.
this is huge for caretakers. Let me just say this because that is one of the really trying things about uh, the disease process and Alzheimer's is that it can totally flip someone's ability to follow that circadian rhythm that we have. And so you guys will hear, or you may have heard things like Alzheimer's patients being having sundowners and whatnot, which is kind of a reversal for them. So when, especially on a full moon, oh Lordy bid, it can be crazy in an Alzheimer's unit because patients very much wake up. They're way more. I mean, I worked in a locked Alzheimer's unit for years. And so we would have patients that would be almost comatose. They would be sitting non-responsive. And we'd have a full moon and everybody would wake up and it was like a wild party sometimes. So it was very interesting that this can make it possible
You
for,
should have had a fake full moon inside the building.
right? Oh, I mean, I had a lot of fun being in there with them. We had a good time, but
Not that it was easy work. I know it was
no,
hard.
it's not easy work, but it's very rewarding. It was very rewarding work. So, okay, moving on.
The study drew on trials conducted in 7 different countries between 2005 and 2022, all related to light therapy intervention for Alzheimer's disease. Most of the 598 participants had mild to moderate dementia, and they ranged in age from 60 to 85 years old. And they talk about how light therapy led to overall improvements in sleep quality, reduced daytime sleep, and increased nighttime rest. Results also indicated a benefit related to circadian rhythm, which is the 24-hour internal clock in our brain that regulates sleep-wake cycles. Light therapy also had a positive impact on psychobehavioral problems, which affect an estimated 90% of people with Alzheimer's. Light therapy appeared to decrease agitated behavior and depressive symptoms, which in turn reduced caregiver burden and distress. The researchers also found some evidence that light therapy was associated with lower measures of cognitive impairment and higher measures of cognitive functions. So basically, you feel better, you act better, and you sleep better with light therapy.
Yeah.
I mean, they say early morning sun is so powerful.
Yeah.
You could go have your morning coffee out in the sun, and literally, like if it's cold, which it is now around here, we need to be dressed, but your face does absorb the rays. Your eyes absorb a lot of the rays. So if you're not wearing glasses or sunglasses, you actually do not stare at the sun.
Correct.
I don't need to say that. You all know this. But yeah, don't stare at the sun. But just being outside without sunglasses and without regular glasses really helps you absorb a lot of the rays.
Right. So it'll be really interesting. I hope they do some long-term studies on this because right now, and even as the article states, there are no drugs right now that can stop the progression or cure this neurologic disease. So it'll be really interesting to see if something like as simple as photo biomodulation can actually slow the progression. So if we're actually able to affect the brain directly through light, man, can you imagine? I mean, from the beginning to be able to reduce symptoms, and then if we can find out if it can actually slow the progression, I mean, this could be a huge, huge break.
How many of those patients in the locked Alzheimer's unit did you guys take outside and let them walk around in fresh air?
We had a small courtyard that we could take some out to. When families would come in, they could also, we had a lot of windows in our area, but you don't get the benefit of the light when you're
UVB
inside.
doesn't go through glass.
Correct. So they weren't out nearly as much as they should have been.
Like
right?
if I said how many minutes per day did they spend outside?
Oh, I would say
Sometimes
on
zero.
average none.
Wow.
But think about it, because what if we replaced all the regular light bulbs, right? Or we had like separate lamps
Full spectrum
with
light
full
bulbs.
spectrum light bulbs, and we could have those on
Yeah.
during the day for our
They
patients.
say 8 hours under a full spectrum light bulb is similar to 15 minutes in the sun.
That's amazing.
15 minutes can have some of these benefits
Absolutely.
and no side effects.
Absolutely.
So treatments include bright light therapy, in which a person sits in front of a light box that provides about 30 times more light than the average office light for a set amount of time each day. Another more technologically advanced approach transmits near-infrared light into the brain via a special headset. Now, our device, they actually say you could put it on your temples and it goes into the brain as well.
Yeah. But the technique itself is not called photobiomodulation. That's so that is incorrect in the article. They're saying that that another more technologically advanced approach, which is called photobiomodulation. That's an incorrect statement. It's all considered, because even what we have, having a handheld wand, so to speak, that has two different heads on it, it is still called photobiomodulation. But
right, and that frequency of red light laser, it's a class 3B laser. It actually stimulates mitochondrial activity, which increases cell metabolism, which promotes healing in injured tissues.
Right, which is why I'm so interested to see if it actually slows the progression and begins to heal, because we know that when the energy inside the cell is increased, that means the healing of that cell increases. And so
I had a headache the other day on the right side, and I put the LED in 2.5 hertz frequency for a minute right there on my temple. So basically it's flashed a red light right there. Literally my headache was gone.
that's awesome.
It was really neat.
Yeah. I think we
hadn't
need
tried that
to even research that even more. I mean, we have great protocols and stuff like that, but man, if we can start helping migraine patients.
So if you're
with that.
interested, look for practices that have Thor laser. Thor laser seems to be one of the more accepted, powerful ones. In the study, this doctor said the results suggest, however, that the combined evidence, though modest in scale, is encouraging but preliminary, and justifies further research in larger, more representative study populations, because they didn't divide the populations. They didn't pick, they don't know if it works better in someone who just got Alzheimer's versus someone who's had Alzheimer's for a while and so on. So, but that's nice. Like, I actually like what he said. He said we need to continue to work on this, continue to use it. But I also go, if it's not, although our Thor laser is FDA approved,
Yeah, it is.
I also say if there's no side effects,
Right.
it's just light, do it to everybody. Just
Right.
make it standard protocol.
I mean,
what are we waiting for?
Thor actually, so we have the handheld device. So we have the laser and the LED head that we can use, and really it's about depth of how far into the tissue it goes.
Right.
I mean, it does act a little bit differently, but one is better at reducing pain versus inflammation and whatnot. But where was I even going with that? Oh, they have a whole bed. So Thor actually has produced, it looks like a tanning bed, but it is all
It's
red light therapy. and people come out of that thing just feeling amazing.
Yeah.
So one day I would love to have one because I would love to be in it a couple times a week.
Yeah.
So that's usually why we get
For
them.
only $100,000, you can
That's
get
right.
one. I'm saving up for it. A lot of celebrities have them in their home.
Now we're going to move on to the next, and if anybody has questions about light therapy, you're welcome to contact the office, leave a message in the comments, or a question in the comments, and we'll have Sean make sure that that gets to us. But yeah, we'd love to help answer those questions if you have them. This next article I find very fascinating. And I'm actually kind of excited about it because I remember, so we're going to be talking about the first FDA cleared at-home insemination kit. I remember, back in like 70s, 80s, hearing about people using like turkey basters to bypass and do like an artificial insemination. So now, although I think there have been others on the market, there is now an FDA cleared kit that people can take home or order online and hopefully help them overcome infertility issues.
Yep. This was
Especially if they're
reported
unknown.
by USA Today.
Mm-hmm.
Go ahead. You want to take it away?
Sure. So anyone who's struggling with infertility knows that getting treatments can be super expensive. So there's a couple of different types of fertility treatments that people go for. One is the artificial insemination, where they're actually taking the sperm and putting it into directly into the cervix, bypassing some of the common challenges that people may have with getting pregnant. Sometimes it could be fluid. Sometimes a woman's mucus can be harmful to the sperm, and so can kill that off before it gets to its destination. So this helps to bypass some of that. And when you're looking to do that at a fertility clinic, they are quite expensive, especially if they have a monopoly in your area. And so those fertility costs, it says it could be anywhere from $300 to $3,000. I've never seen one of these treatments as low as 300. That's quite inexpensive. I think 3,000 each round. And that is the cost of the, maybe the treatment itself, but this is outside of the cost of medication, which also
Right.
come along with that.
Yes.
Often the cost of the medication is at least the cost of the treatment itself, if not double. And so it can be quite expensive. So this FDA at-home kit is for what they would consider an IUI, which is an intrauterine insemination, which is different than IVF. IVF, they actually take the eggs from the woman and inseminate the eggs, fertilize it in a petri dish, make sure that they're beginning to grow and divide as they're supposed to. And they have to get to a blastocyst stage before, which is, I don't know how many cells. I don't remember how many that's considered.
It's now considered an embryo.
Mm-hmm. And then they
implant it.
Correct.
So that's more expensive.
Yes, a lot more expensive.
The article says $15,000 to $30,000, but again, people who do IVF are probably spending $3,000 to $5,000 a month on medication
At least.
for it as well.
Yes. So, so this is now just an unbelievable opportunity for people to begin doing this at home. So this week, the U.S. Food and Drug Administration cleared a kit for use by consumers. And here's what you need to know. The new kit is made by Mosey Baby. It's an Austin, Texas-based company that described itself as a pioneering at-home fertility care company. They have made the Mosey Baby Kit, which is now the first and only FDA-cleared over-the-counter option for intravaginal insemination, according to the company. The kit was found to be substantially equivalent to a clinically administered insemination. So that's really, really cool because we're talking about a fraction of the cost. The kit is designed for use with either a fresh or cryogenically frozen donor. semen sample. So, meaning those attempting to conceive have a few options for a sperm source and could potentially use an outside donor. So, this is something very new too. So, if you had sperm from a donor, or your sperm that had been frozen before, then you can actually bring that home, defrost it according to, they have videos to watch and instructions and whatnot that you have to find, or that you have to follow. But it's actually quite impressive. So they have a patented cup that's used, and it's rounded at the bottom, which is supposed to allow for you to be able to get the most out. The whole syringe that's used has been created for comfort, so it's going to be very similar to like the feel of a tampon for a woman. The plunger is also very specific, and there's instead of it having a round, or I guess what they would call a barrel opening, which is just a regular round opening, their syringe tip actually has a more oval opening, which is supposed to mimic I guess the head of the penis. We should have probably put a
Yeah.
there's some
Kids
content.
not.
Yeah.
Yeah, kids are not allowed.
Maybe pause this and move your kids. But anyway, it is supposed to all mimic that, which is supposed to allow for a better transfer with minimal waste and loss. So they've really thought a lot about this. I was impressed about the cost. So in the article, it actually says that the kits are being sold for $129.99. Believe it or not, they are less than that. It's actually, right now, the cost on their website is $99
Wow.
for a kit, which includes 2 dishes, 2 syringes, and all that. You also can do a subscribe and save for $84.15 a month. So if you choose to do that. Now, I was curious as to how long, because fertility process can take a long time. So this is usually recommended for people who have tried for a year, right? And that's when, after trying for a year, I know when teeny boppers go and do things they shouldn't be doing and they get pregnant, we all think that this happens so easily. But the process of getting pregnant is actually fairly complex, and there's a lot of obstacles that could get in the way. And so they usually recommend trying for a year. If unsuccessful, then picking up the Mosey Baby Kit. And in their recommendations, they recommend trying for 3 to 6 months. If you are unsuccessful after 6 months, then they recommend pushing you back to a specialist. Also, I did find that this is FSA and HSA eligible. So that means you can use your health savings account or your flex account in most instances to pay for this as well. They also have special kits, which for $166, you can get the insemination kit, lubricant, and it's lubricant that is safe and won't destroy the semen, 2 pregnancy tests, and 7 ovulation test kits. So,
Wow.
and that's a great cost savings for individuals.
She said she invented this in 2014.
Yeah.
And the article also said, I believe 1 in 6 people struggle with infertility.
Yeah.
I don't think that's always been the case.
Yeah. Yeah.
Because, I mean, fertility clinics are popping up everywhere, and they're very profitable.
Well, let's think about it. We've talked about a lot of things in our articles, which we know lead to infertility.
Yeah.
We've talked about chemicals, forever chemicals. We've talked about the various chemicals that have been allowed in our food, which we know are endocrine system disruptors. And when the endocrine system is disrupted, then you're going to struggle in a lot of cases to be able to conceive. So there are also pharmacological issues that can get in the way. So there are medications that can make it difficult. Women go on birth control for years on end. Doctors don't say, hey, this might be a problem down the road. You might want to think twice about that, right? So there are a lot of things that we do to our bodies all the time, and toxins that we're exposed to that are creating these issues. And that's why infertility has grown to such a huge business. There have always been fertility issues, but not to this level.
Not this
So,
much, yeah.
yeah. So I think, I think it's fantastic now that we have an option. It's available. I checked out the site. It's a great site, easy to get to. So, I think.
I learned a new word reading this article.
What was that?
There's a word called cisgender,
Oh, yes.
and I didn't know what that meant.
Did you look it up?
I did.
Okay.
It's the opposite of transgender.
Oh. Okay.
So I guess, yeah. So anyways, take it for what you want. It's a new word.
Awesome.
I didn't know that was a word. CIS gender
Yeah.
is all one word, and it's someone who is not transgender.
Oh, okay. All right, moving on.
Next article is from USA Today. Title is A Car Crash Damaged Her Brain. Years later, electrode implants gave her a brighter future. For 17 years after her car crash, Gina Arata couldn't focus enough to read a book or watch a movie. She repeatedly used poor judgment in circumstances she hadn't before, like dating men who weren't good for her. Her balance was also off, and she tripped constantly.
Initially, when I read that, I thought, that's interesting. And then I remembered sometimes tumors, right, pressing on certain areas of the brain can actually affect impulse control and decision making and stuff. So that's what I kind of, connected that to.
Yeah.
But I thought that was a very interesting thing that she identified for herself.
I would like to have brain damage that makes me get rid of my dyslexia.
Yeah. Yeah.
I wonder if there's you could reverse.
Try some light therapy.
I'm going to do that. I'm going to laser my brain starting today.
Do it.
She worked sorting mail for a while, but by 2 or 3 in the afternoon, someone would have to come help her finish the job because she had so much trouble remembering the alphabet. That's sad.
So with fatigue, right?
Yeah.
Her processing was affected.
Which is what happens to me when I read too much. I read slower and slower and slower, and then the words all get jumbled.
Every woman who's ever had a baby can totally identify with this at some level.
You forgot the alphabet?
I would forget a lot of things. Not the entire alphabet, but I will say, after having a baby and, all of your resources being shared, trying to develop that little person really, really affected that processing.
Well, 5 years ago, the Modesto, California resident volunteered to become one of the handful of patients and the only woman in the clinical trial led by researchers at Cornell and Stanford universities among people who had experienced moderate to severe brain injuries. Doctors implanted electrodes in 2 precise locations deep inside her brain and a stimulator in her chest. It took a while to adjust, but once she got used to the stimulation, it transformed Arata's life. Arata, who had been studying for law school entrance exam before her car hydroplaned into a telephone pole, could read a book again and remembered what she had read for the first time since 2001. She could control her emotions and no longer blurted out the first thing that came into her mind. She could consider other people's thoughts and feelings instead of just her own. The other 4 traumatic brain injury patients who completed the trial also saw significant improvements in so-called executive function. Many more people need to be treated before the procedure can be considered a success.
Pretty impressive.
More than 5 million Americans are estimated to have a moderate to severe brain injury limiting their abilities. And the team that worked on her said that They hope by stimulating the circuits involved in consciousness, arousal, and attention, they could help patients regain some ability to concentrate and focus.
Mm.
I wonder, we talked about Alzheimer's earlier in the podcast.
Yeah.
What if we did light therapy? And I mean, you don't want implants, but didn't Neuralink was supposed to be helping people with debilitating brain issues?
Well,
This is
more,
Elon Musk's company.
yeah, but I think that was more of being able to control technology with their brain when their body was not accessible to them.
Right, that makes sense. So the precise placement of the electrodes done with computer modeling and imaging was key to the treatment success. Electrodes were placed on both sides of the brain in an area called the central lateral nucleus of the thalamus, a kind of relay station that connects the part of the brain involved in consciousness, alertness, and sending signals to other parts of the brain.
You know what I found interesting? She did say in here that she said, my life, why she chose to get the surgery. She said, my life wasn't going anywhere. My life wasn't getting any better. So she decided to volunteer for the trial. And then it says she wasn't convinced going in that anything was wrong with her. She felt normal, she said, and thought that everyone else was crazy, but not her. I go, those two statements totally 100% contradict each other.
Yeah.
I'm like, if her life wasn't going anywhere and it wasn't getting any better, then she clearly knew something was wrong, and it was her, not everyone else was crazy. Do you know what I'm saying?
Right.
Like, that was odd to me. So
I know.
Anyway,
I know.
just
it
a
was
side note.
interesting.
These are the things that pop out to me in stories.
Brain trauma does crazy things to the brain.
Okay.
What else? She said, I feel like I was robbed of a big chunk of my life. She wished she had done it sooner, she said. The years between her accident and her surgery, which took place 2 weeks after her 40th birthday, are the years people typically marry and have children. While she still hopes to have a meaningful relationship, Arata feels it's too late for her at 45 to have children of her own. Well, maybe she can grab that
Mosey baby kit.
Mosey baby kit and try.
It's very possible.
Her life hasn't been completely rosy since the surgery. In another stroke of bad luck several years ago, Arata, then studying to become a dental assistant, caught a viral infection that left her temporarily paralyzed. For the second time in her life, she had to drop out of school and relearn how to walk. Now, it says people who come out of a coma are considered to be doing great if they're able to live semi-independent lives. But Henderson, whose doctor, said that he hopes to be able to get them closer to where they were before their injuries. This offers some hope to potentially get back to some lost functions. They hope this approach will also be extended to other people with brain injuries, such as chronic traumatic encephalopathy, which has plagued professional football players, among others. We have a lot of veterans who've had brain trauma as well, with explosives and so on.
Yeah.
So our heart goes out to them. Hopefully this works well, and hopefully this becomes something that has no side effects. I mean, she's had it for 5 years. I guess it's been good. So hopefully there's hope for all the others.
Yep.
But anyways, we talked about Alzheimer's and artificial insemination and brain injury with electrodes. Fun stuff. We'll have more articles for you next time, so please tune in and share this.
And don't forget to laugh.
Laughing sessions. That's right. Let's do that right now.
Yeah.
Off camera.
All right.
Take care.
Bye.